Welcome to our Bellin Total Health Spotlight today. And just to start this off, we spend more time at work than outside of work. And as an employer, what if you could help your employees and their family members do three things? One, improve their health. Number two, improve their satisfaction with care. And number three, help save dollars along the way. Well, my name's Randy Van Straten, and I'm here with the R.W. Fernstrum and Company in Menominee, Michigan. And you know what? They've figured it out. So I'm so happy to introduce Jean Granum, CFO. And then with us, we also have Marla May, our nurse, our Bellin nurse, that is at R.W. Fernstrum and Company. So with that said, your company has absolutely adopted our total health package, and that total health package has really six components to it. We're going to go through these. But before we do that, Jean, I'm just wondering if you could just tell us a little bit about the company.
Sure. R.W. Fernstrum and Company is a family-owned business manufacturing company in Menominee, Michigan. We have been here since 1959. The company originally started with Robert W. Fernstrum. He worked for a Department of the Navy contractor and developed a product that the Navy was in need of for the Second World War, and has turned that product into an international product. Now we sell our product around the world, and we've tried to develop a wellness program here at work that truly cares for our employees. We decided that about, I don't remember, probably 8 to 10 years ago, that we wanted to offer something a little more inclusive for our employees that would hopefully contribute to their wellness now and their future wellness. We're very family oriented here.
That's great. You know, it's great to see these companies in our region here impact the entire world right out of Menominee, Michigan. It's so neat. And then to see you focused on your employees there. So let's start with the subject of our one key driver is partnership. What's your definition of a partnership, and how and why did your organization and Bellin Health seek out that partnership?
We were looking for a partner to help guide us with our wellness program, but also supply the resources that we needed. And we were looking for a partner that matched our company culture. And in the research that we did, we felt that Bellin was the closest match for us. We're a small company. We try to tailor things to individuals' needs here. And we felt that Bellin was very responsive to that and very able to make changes on the fly as we needed them to be made.
That's great. Now, Marla, thanks a lot for joining us. How long have you been a nurse with Bellin? And then could you share your experience at Fernstrum?
Yes, so I've been with Bellin almost 5 years, and I've been with R.W. Fernstrum about 2.5 years. You know, it's great because I'm actually here today on site with them. I'm here every week on Tuesdays. And, you know, we're talking about partnership, and we just have this really cohesive team atmosphere between Bellin and R.W. Fernstrum. For example, we met today with our wellness committee that is part of Bellin and people from R.W. Fernstrum, and really just coming up with our plan for next year. And, you know, it's just, I've always felt like I'm just part of their team, even though I'm here helping them be well and helping them succeed with their wellness program.
That's great. Nurse right on site. Now, Jean, sometimes it's a challenge for companies Many companies think they need to have 100, 200, 500 employees to have a wellness program. You've got under 50 employees there and you figured it out. So just tell us a little bit about that.
It takes a commitment from the ownership to be able to do this. So the owners of the company early on made the commitment that yes, we're going to support this program. We have 36 full-time employees right now. There is a definite family focus here. So, you know, if most places that you work give you vacation time, sick time, those kinds of things, here they allow you to use that sick time if your children are sick. And what I discovered when my elderly parents came to live with me is they also allowed me to use my sick time if I needed to care for my parents. So there's a very a willingness to work with employees and their families. When we first started this program, I put together a committee, and this is prior to Marla coming on board with us. But I put together a wellness committee, and the first time we sat down, I remember the question came up, yeah, this is going to be like any other, you know, gimmick, any other program that, you know, you see companies put into place and then they, you know, a year or two later, they're gone. And my feeling was that I didn't want to see that happen. And so I made the commitment to them at that point. As long as I'm here, the wellness program is going to be a thing. We're going to be doing this as long as I'm here. And again, that was 8 to 10 years ago. I've been here for 17 and a half years, and I will be here for a few more yet, but I don't see this program going away. I really don't. It's been had a huge impact on our employees. And I really don't see the company letting that go.
That's great. You know, you're really speaking of culture, and culture is part of really creating that partnership. And it's also part of community, which is our second key driver. So, you know, if you could just define how, you know, you guys engage with the community and how you support your local area up there in Menominee too with your program.
There are parts of our program that reward employees for doing community service. So if they're volunteering at their, you know, their kids' athletic program, if they're volunteering at their church, if they're donating blood, which is one of the things that's near and dear to my heart, all these different things where employees have an impact on the community are rewarded through our wellness program. So we really view having an impact on our community as important to us.
That's great. You have a quote too. You have a quote about a small workforce, but making a big impact, right?
That's what we like to see.
That's awesome. And you've got an example, your angel tree, I think it is, right?
Yes, and I actually just put it up today, coincidentally. We have what we call a giving tree here. And every year we partner with a community organization, different ones, sometimes different years. This year it's going to be partnering with the people who care for our foster children within the community. So we ask them to give us the needs of those kids for Christmas. So each kid makes up a list of here's my needs, here's my wants, and we put those all on, hang them all on the giving tree, and employees can come in and take those tags and go out and purchase the items these kids need. And then we provide it to them for their Christmas.
Oh, that's great. Really, you know, you're focusing out, which then benefits inside the organization.
Absolutely.
And that's really neat. Now, Marla, you work alongside all these efforts. Can you share some of the work you've been involved in?
Yes. So I am here weekly. When I first started with this account, I was here twice a month. And then we just really started to realize that having more of a consistent presence was going to be a lot more beneficial for the employees. They were going to be able to meet with me weekly. The majority of my work is doing health coaching. So really focusing on the physical needs, nutritional, spiritual, emotional, mental, like the whole holistic person, and really understanding how their work impacts their health and how their health impacts their work. But really identifying that need to be here more often was really pivotal. When I first started, we had done just a basic survey, asking, what did people want to see from their wellness program? And now we have gotten so much energy behind it. We actually, which is actually different than most trends, we have more people from the production area like really involved in our wellness program than we have in office staff, which is not something that you see every day at companies. So we've really seen this really great momentum since Bellin has been able to provide a presence here weekly.
Oh, that's great. That's great. Now, the third component of our total health model is data analytics. So, we've talked about partnership, we talked about engagement with the community. Now, how do you measure success? How are you measuring success? Any examples that you have to share?
So many times we think that we have to see impact in terms of dollars. And sometimes that's not terribly easy to measure because the impact that we have may be 10 or 20 years from now. We're hoping that people are healthy and happy while they're here, but we also want them to be healthy and happy in their futures, whatever that is, if it's retirement or moving on. So I think we here put a lot less emphasis on how is this impacting our health insurance dollars, how is this impacting our health reimbursement accounts, those kinds of things, and more on what is the level of satisfaction and overall feeling of well-being among our employees. That to me is what is more important, is how is it impacting our employees and their lives.
Well, and I think some of those things really relate to cost too. So for example, I know when we talked previously, your retention rate is crazy in this world right now. How you've been able to train and retain employees for your firm.
Right. It's unusual. We think it's kind of normal, but I think our retention rate right now, our average years of employment is about 13 years per person. Now, that takes into consideration that we've got some people that have been here for more than 40 years, and we've got some that have been here for less than a year. But on average, people have been here for 13 years. So we don't have to typically advertise when we are looking for new help, because word of mouth, our employees get out there and get their friends to come and apply or whatever. And we typically don't have to advertise when we are looking for employees. We've been very fortunate in that because for several years, it was difficult to compete for new employees, and we've been very fortunate in that area. And I'm sure that some of this is a help in finding employees.
And you use data also with the health risk appraisal platform, correct? Mm-hmm. So Marla, just share a little bit about that. I mean, you help do these, you help link to some incentives, people are participating. How's that all working there?
Yeah, so every year the employees go through the health risk assessment, which entails having their blood drawn and doing a self-assessment piece of it. And then I sit down with each person, and we feel it's beneficial here at RW Fernstrum to not only give them their results, but have them sit down with me to understand what those results mean. So when we talk about cholesterol numbers or BMI, I mean, those are numbers, but the employee doesn't necessarily know what those numbers mean. And so I really sit down and talk to them about, what these numbers are, how can we improve them, what factors went into that to maybe have them be at those certain numbers. And then we tailor a program individually to how they can be healthier, how they can improve those numbers. And the HRA is just one aspect of a person's well-being. It doesn't tell the whole story, but we felt here that that the more information that the employees have, the better choices that they can make with their health and well-being. And so we have that HRA as an incentive. Jean, maybe you can speak a little bit more about the dollars associated with that for the reimbursement.
Yes, we also we provide a dollar award for doing the HRA and for sitting down with Marla, but we also give them a half a day of vacation. And
nice.
Yeah, it's kind of amusing because I can guarantee you that there are people that have the HRA done simply because they want that half a day vacation, and that's fine. That's absolutely fine. We're just thankful that they're willing to do that, to come in and provide that for us. You know, it's helpful. It's very helpful to the employees to sit down with Marla and go through these things, but it's also helpful to us as a company. We get aggregate numbers. We don't see the numbers or the information on an individual because of, you know, HIPAA laws, things like that. We don't want to see those, but what we do see is the aggregate. So how is the general health of our employee base here? How is it trending? You know, what are the areas that seem to need to have some education? And that helps us to formulate our program each year based on what we see as those aggregate results.
Yeah, and that's a great segue into the fourth component, and that's really health and well-being. And what I heard you say, Marla, too, is as you work with individuals, your approach is not, you know, what's wrong with you, but it's what matters to you. And Jean, what matters to the entire population there for health. So it's you're gathering the data, and now you're leading into that health and well-being program. So I'm just wondering if you could share a little bit more about, you know, how that occurs there on site too, on a day-to-day basis.
Well, we've done a couple of things. Like Marla had mentioned, we have a wellness committee that sits down and says, you know, we ask, what do you want to see? In fact, we just today talked about doing a survey, and we've done surveys several different times to find out what it is that's important to the employees. What is it that they feel their needs are, and how can we help meet those? So we have done surveys. We've and also sit down with the wellness committee, which is chosen from both production and office areas, to try to get a feel for how can we best put together a program that's going to have an impact on their well-being.
And I think you're doing a pretty darn good job, because I'm seeing numbers here of over 75% participating. Mm-hmm. How do you make that happen, Marla? What's the secret sauce?
The secret sauce, I'm not really sure what that secret sauce is, but I do want to go back to the piece about what matters to you. So, you know, people meet with me because, you know, they might want that half a day vacation, or they want those incentive dollars, but, you know, their HRA results may show a picture that says, well, we need to improve our, you know, lipid panel, you know, perhaps a person might need to lose weight. But when I sit down with them and ask them, what is important to you? It may be stress management. It might not be anything related to those numbers specifically, but we really, you know, I listen to each person. They feel comfortable with me. They trust me. And that's very, very important when you're creating that relationship with employees. And I remember when I first started, you know, people, you know, they have to kind of feel you out. You know, can I trust this person? Is she going to follow up on me? And just always closing that loop and checking in with people. It just really builds that relationship. And I feel like creates that really solid partnership that we have here.
We've also put in place some challenges that have been just a whole lot of fun. When we think of a challenge, so many times I think of a challenge that's a personal challenge. How many sit-ups can you do, you know, every day or whatever? But Marla and Allison have put together some fun team challenges. We've had 2 different team challenges now this year, and I've been really pleasantly surprised at the participation. I think the last one was our Tackle Your Health challenge, which is a football-based challenge, and I believe we had 18 people participate in that. So that's half of the workforce. And so we had two teams competing against each other, and it was just a lot of fun. There was a lot of, trash talking going on. There was a lot of pushing each other and, hey, did you really do that? Or are you telling the truth here? Just a whole lot of fun. It was very motivating to the people involved to get up and do the things that we were putting forward in that challenge to have them do. So, that when we talked in our committee meeting this morning, we talked about maybe we should be doing a group challenge or a team challenge every other month instead of, just a couple times a year. You definitely get more participation.
Absolutely. Absolutely. And, I know after doing this work for 35 plus years, a key indicator too is key leadership support. And it sounds like you have that from the top down. And then also you get these collection of successes, but within the collection, there are individual stories too. So Marla, do you have a couple examples of some individual stories that come out of these challenges?
Yeah. Well, the most recent challenge we've had people join that challenge that have never participated in anything, which was really exciting for me as kind of the wellness champion here. But, we've had a lot of good individual successes too: increased activity, weight loss, stress management, tobacco cessation or reduction. Just, when I think back on some stories, we have one person who went from drinking 24 cans of soda a day to drinking 2. I mean, they can be anything, big or small. Team successes, department successes. It's just been really wonderful here.
Yeah, and then to have, Jean's team remove the barriers so that you're right there on site. You can help coach and help talk about health, but a case of soda a day, but yet you were there to help reinforce the importance of it, and probably some group support around that. That's a big lifestyle change. And those are these little decisions you make every day that make that impact that Jean was talking about, maybe 5 years, maybe 10 years, maybe 20 years down the road. But, we like to say these types of things save lives before lives even know they need to be saved.
Right.
Exactly.
So that's great. So we move into our fifth topic here, and that's safety. So both creating physical and psychological safety are critical to health and well-being. Jean, can you share how have you partnered with Bellin to promote safety for your people at the workplace? Because I know you've got a highly industrialized location too. There's a lot of things going on there.
Right. I'm going to, blow our horn just a little bit here. We have a very good safety record here. Typically, the owners, if they see there is a possibility of a problem, will step in and fix it before it becomes an issue. Just as an example, there was a product that was being used here in production, and we're talking many, many years ago, that they decided to remove from the production process and find a different way to do it because they were concerned about the health, the possibilities of it being unhealthy. And so they removed it. Since then, Michigan OSHA has declared it to be a problem and you need to remove it from your workplace. So they're very proactive as far as trying to maintain a safe work environment for their employees. We have just recently, I'm going to say within the last year, partnered with Bellin for our pre-employment physicals, drug tests, that kind of thing, and for return to work. Because we feel, again, that the culture at Bellin is a very good fit for us. They're very willing and able to modify the way that they do things to match what we have for needs here. They sent a team in to look at our production process and to come up with an assessment, a physical assessment for us, for our prospective employees. So we've been very, very happy with how they've worked with us on that.
That's great. Well, wrapping this up here with our sixth key driver is navigation. And healthcare can be really complex these days. It really can. but yet there's all these tools out there. There's smart apps, there's computers, there's this, there's that. But oh my goodness, Jean, you've got Marla right there. So if you could just, how does Marla help people navigate their health and the healthcare system?
Well, we love our Marla. We've been very happy with.
Wait, what if other companies want a Marla?
That's fine. They just can't have ours. We're not letting her go. But she, helps to create that bridge between what they do here and the healthcare community. So does the wellness program to a certain extent. They get awards for getting their annual physical, for getting their twice-a-year dental exams, for getting their vision exams, those kinds of things. And I know that Marla promotes that. One of the things that we do, and in addition to Marla promoting it, which, you've heard that so many of our employees are doing health coaching with her, we don't use apps to communicate. Typically, it's either Marla's talking face-to-face with somebody, or I'm walking out on the shop floor and asking each individual, are you interested in doing this or this, or the next thing coming up in the wellness program, are you interested in being involved in this, and encouraging them to do that. We have some tough cases that just aren't really interested in that, but we just keep working on it. We'll see what happens. But yes, in this age of technology, we've tended not to go that route with the wellness program.
Yeah. And you're working with pipe fitters and welders. So, Marla, you're out on the floor. You go out on the floor and meet with people. Can you tell us a little bit about that?
Well, yes, Jean has taken me out on the floor. I would not say that I'm out there a lot, but the awesome part is that if I need to see somebody, people jump right up. Yep, let me get them for you. It really comes back to that human interaction. We have all this technology at our fingertips that we can use, but here, face-to-face communication is, I don't know, maybe that's the secret sauce.
Well, the one key thing, it's one of Bellin's key values, and it's belonging. And it sounds like, everyone belongs with this effort. You've got your wellness committee engaged and feeling, that they belong to this. You've got upper leadership involved. You're removing barriers with putting Marla there at the front lines to help with people and help them navigate. Boy, this really, really comes together, it seems, Jean.
It does. We're not perfect. We're not there yet. We would love to have 100% participation. We know that's probably unrealistic, but we just keep trying to get there by making it more accessible and more attractive.
Mm-hmm. Well, we've hit now our 6, believe it or not. We've hit our 6. So we talked about partnership, right? We talked about community, talked about doing that data analytics. That gives us breadcrumbs to move towards what health and well-being services we need. Talked about the safety of the workforce, and then helping individuals navigate. Those are the components of the total health model. So on that note, any parting words from you, Jean?
I am very, very, I feel very blessed to work here, to have this opportunity to provide this for the employees. My focus for the greater part of my life has been on health. And so to be able to then, hopefully provide that focus for other people through this program has been very personally rewarding. And I'm very, very grateful for the opportunity to do that here.
That's great. That's great. Marla, any parting words from you?
Yeah, I love what I do, and I really love that Bellin offers this to companies to have us be able to reach employees where they are, sit down and have conversations. I'm grateful to RW Fernstrum for welcoming me and always helping me feel part of the team. I just, you know, you never know what is going to impact people or stick with them. And I'm just really grateful to have that opportunity to have that conversation with people.
Yeah. Makes you feel good about what you wake up and do every day, doesn't
Yeah,
it? That you're helping
absolutely.
people. You're
Mhm.
helping people. And that's what that's really the business that we're in, is helping people and producing results that do those three things we talked about at the start. And that's, number one, how do we help improve the health of individuals? Well, that gentleman not drinking a case of soda a day, that's going to impact his health and
Absolutely.
probably put some money in his wallet too.
That too.
Right?
Exactly.
Right?
Yes.
So, but then making these choices that helps, save dollars, not only for individuals, but for the company. And then people are satisfied with their healthcare too, because you can help guide them for quality interactions. So great. The other thing I learned today, too, is that it's great to see this type of impact on employers of the size. You said, Jean, 36 employees.
Yes.
That's wonderful. You're making a difference there. And so if you've got any interest, I'm speaking to the public out there, if you've got any interest in us helping you, or even doing just a free strategy session to learn more or to understand what we do more, to do an assessment, you can go to bellin.org/for-business, and you can connect and send us an email, and we'll schedule up some time to get out from our walls. That's what Bellin does. We get out from behind our walls of our hospitals and clinics, and we engage with businesses and the communities. And that's why we are, basically a community, not-for-profit healthcare system here, ran by a local board of directors too, working to improve health every day and helping our communities thrive. On that note, we'll let you two get back to all the great things you do on a day-to-day basis. And I just want to thank you so much for joining us for the time. And I can't wait to get a tour out at your facility too.
Well, we would love to have you here.
All right. Well, thanks a lot.
Thank you.
Thank you.